Good morning. Good morning. You're welcome to our pharmaceutical calculations ability to 5-3 lectures. Today we'll take a look at dosage calculations. Dosage calculations. Okay. So good morning. Good morning. We are going to treat this topic under. We look at adult dosing and pediatric dosing. Adult dosing and pediatric dosing. And we're not going to waste time on this topic because we've treated almost everything you need to know here when we discussed ratio and proportion. So that's why I wouldn't waste time here. So we'll start by knowing what is a dose. If you'll be hearing this term, a dose. So whenever you hear the term a dose, what comes to your mind? What is a dose? What do you mean by a dose of a drug? Any idea? Amount of a drug to be taken. Any other idea? Okay. A dose of a drug is the amount of a drug or drug formulation taken by or given to a patient to achieve a particular therapeutic outcome, to achieve a specific or particular therapeutic outcome. Before a medical doctor, a physician, or a prescriber prescribe a medicine to a patient, the person must have something in mind, that there's an outcome. There's something the prescriber wants to do achieve. And a particular amount of drug, of such medication or drug, we have to achieve that at a particular point in time. So whenever you hear the term a dose, what comes to your mind is the amount of a drug prescribed, given, or administered to achieve that particular outcome. So a dose of a drug, drug doses can be single, can be daily, it can be weekly. Even in that daily dose, it can be divided depending on what the outcome, the intended outcome. So when you hear the term single dose, hey, shut. When you hear the term single dose, what comes to your mind is you give a particular amount of a drug just once. You're not repeating that dose again. Or even if you want to repeat it, maybe another time, but at that point in time, you just give that particular dose. Sometimes you see it in prescription, like, let's assume you have something like an injection. You see something like this, IM, ceftriaxone. ceftriaxone, maybe 1 gram, start. Something like that. What it means is that you are giving just that once. There are some drugs like some tablets, maybe for the one for example of an antiemetic like albendazole. You see something like this. Tab albendazole, 400 milligram, start. So that's what you see. This is a single dose. Am I communicating? Single dose. Then you also have daily dose. Intramuscular.
This start means
once. Just that's all. You're not giving again. Am I communicating? Good morning. Now, this is for what? Single what? Dose. You also have daily dose. Daily dose. Under this daily dose, you also have single daily dose. So I want to distinguish between single daily dose and not an ordinary single dose. So you don't get confused. We have single what? Daily dose, or some call it daily single dose. Anyone is okay. Then you also have daily divided what? Dose, as the case may be. Now, under daily single dose, you see something like, let's assume you may be given a particular medicine to take for like maybe for 5 days. But you're taking it once what? Daily for like 5 days. This is what you call what? Daily single dose. Daily what? Single dose. I think the best thing is daily single dose, not even single daily dose. Even though daily single dose is better. Then daily divided what? Doses. If you see something like there are some drugs. You see something like what is it called? A drug for, let me use antihypertensive drug like amlodipine. You see something like amlodipine tablet, amlodipine 10 milligram OD times, let's say 1 month, or depending on 2 weeks, depending on what they want, how they prescribe the 2 weeks or 1 month, as case may be. You see something like this. Tab amlodipine 10 milligram OD times 2 over 52. This talks about what? Just once what? Once a day. Some prescribers may just go straight and say 10 milligram daily, okay? Times what? 2 over 52, or 1 over what? 30, or 1 over, depending, or 1 over 2F, as the case may be, maybe for 1 month. So any prescription like this is the dose here is what? This is a what? Daily single what? Dose. Now you may daily dose can be in what? Daily divided dose. Daily divided dose. That daily divided dose can be twice daily, 3 times daily, 4 times daily, as the case may be, depending. So you see something like your omeprazole. You see cap omeprazole 20 milligram. You see BD times what? Let's say 1 week, 1 over what? 52. This is double. Is daily divided dose, but what? Double, right? You may also see something like. You may also see something like cap How many lecturers do you have in this class? If you have a question, ask someone on the board.
Once then, so I'm asking the 52.
It's what?
The 2/52. 2 times.
How many weeks are there in 1 year? So 52 means weeks. So if you have 2 of 3, it means 2 weeks.
Okay, twice.
1 day for 2 weeks. Didn't you do this in your first year?
No.
Wow. Okay. Come in. This is serious. This is twice, once daily for 2 weeks. 2 of 2 means what? We have 1 week. This 52 means we have 52 weeks in a year. So 1 means 1 week for 1 week. Over 7, we have how many days in a week? 7 days. You see 2/7, it means 2 days. 2 days out of the word 7 days. So this means 2 days. Am I completing? You see 1/52, there are 52 weeks in a year. This one means, this one now is talking about 1 week. So the person will take the draw for like 1 week. This is for what? 2 weeks. Am I communicating? Then if we have something like this, 4/52, it's actually what? 4 weeks. So standard, some use, if the prescriber wants you to take it for exactly 4 weeks, you write 4 weeks. But if you wanted to take it for like 1 month, as in maybe his target is like 30 days, as case may be, you see something like this, 1/12. There are 12 months in a year. But this is better. You know why? This can be confusing. Some months may be 31 in a month. Some may be what? 30 days, right? Some even be 28 days. So it can be confusing unless you are familiar with the doctor's pattern, the physician's what pattern. Unless you are familiar with the what, the physician's pattern. That's when you understand what he meant by what. His own 1 of 52 may actually be what, 28 days or 30 days, depending. But if not, the best thing is to write 4/52. So everybody knows that we are talking about 4 weeks. That is 28 what? Days. Am I completing? But anyhow, each of them means, this is also talks about 1 month, right? But what the doctor has in mind here is what? Actually 28 days. Am I communicating? So this is what all this is mean. So if you see 2 of 2, this is what? 2 weeks. 1/3 is what? 1 week. Are we together? Then you see something like cap. Let me just one that has a shorter duration of treatment. We have something like paracetamol. Give me marker. We have something like paracetamol. Paracetamol. We have Fanadol. We have 1 gram. 1 gram TDS times 3/7. Fanadol. Paracetamol. 1 gram TDS times what? 3/7. This means what? 3 times daily for what? For 3 days. 3/7. But there are 7 days. There are 7 days in a week. So this is counting 3 out of 7. Talks about what? 3 days out of the 7 days we have in a week. So this is 3 days in a week. So this one now, this is 3 days divided 3 doses for what? 3 days. This is what? Then we have something like ampiclos. We have something like this cap ampiclos. We have cap ampiclos, Fanadol, 500 milligram, QDS. Let's say 5/7. Let's say 5/7. This is actually the actual dosage, the actual duration of treatment under normal circumstances. So now this is talking about 5 days in a what? In a week. Now, but But if you come to anti-infectives, if you're dealing with anti-infectives, when I say anti-infectives, I mean drugs that fight a particular organisms that must have infected the patient. Something like anti-malaria. You know, anti-malaria fight a particular organism, which is what? Plasmodium, right? Good. Something like antibiotics. They fight bacteria, right? There's something like antifungals. How many of them? Antiviral medications. All these things now. If you're dealing with anti-infectives, please, anyway, it's just for those that may be in practice, maybe community practice on your own, where they have no doctor. The dosage, this thing now, it should not just be 4 times a day. Like now, here now, we have ampiclos now. Ampiclos, QDS. This should not be just 4 times a day. The QDS, it should actually be 6 hourly. Because if you go to the microbiology background, you realize that there's a specific level of the drug that should be in the system to be able to do what? Tackle the suppress or take care of the organism. We call it MIC. MIC, minimum inhibitory concentration. Minimum inhibitory concentration. There should be a minimum level that should be in the system to be able to do what? Tackle this organism, because they should not be, you don't pack the antibiotic, boom, if you say 3 times a day, the person may just take one now. After 1 hour, you take another one. After, no. It should work well at a specific interval. That is for anti-infectives. But for this one, it doesn't really matter how many times, the time interval, provided that it has not exceeded the particular amount that the system can hold at a point in time. It has no much. You can just say morning, afternoon, night. No specific enough. You may even be 4 hours different, depending on how. That's why sometimes if you see paracetamol, you see something like PRN. What is PRN? What is PRN? What is PRN? What does it mean?
When necessary.
Well, what? Necessary. Please, you don't wait. Please look for. There are some things you can search on your own. Not everything that you be taught in class. You try as much as possible to look out for this Latin abbreviation. These abbreviations used in drug prescriptions. Okay, these are things you can search out on your own. Search for them, study them, and know them on your own. You must not wait for everyone to come here and start teaching them one after the other. No, it may not be like that. Okay, so such as now, so like paracetamol, you can say when necessary, but you cannot say when necessary when you're dealing with what? Infective. You can take paracetamol now, and the headache will stop. You may leave it, and tomorrow again you may feel it again. You may take it once a day and leave it. Tomorrow again, but this one you don't take ampiclos once a day and leave it and say, now I'm beginning to. I am regaining myself. Let me leave it. Tomorrow again, you start feeling somehow again. You rush and take ampiclos. No. You are messing up the system. You are fanning the flame of resistance. You are fanning the flame of what? Resistance. To the extent that when you want to use the drug again at that time, it may not do what? Be that what? Effective. Am I communicating? Because the bacteria would have developed various means to tackle the what. So you don't give the bacteria the chance to start developing mechanism to tackle the what, to tackle the what disease. If not, apart from that one, you start what we call other things we call relapse. Especially when it comes to anti-malaria. The thing may come back again. Some go and buy artemether lumefantrine. They will take 1 dose, 2 doses, and if they can move their body, they will carry the rest and do away, throw it away and abandon it. Give them for like 1 week. They come down again with what? Malaria, with all strengths, with all might, safe. That they may even be, if care not taken, they may even be be rushed to the hospital for what? Or that other level of what? Treatment. So the point there is that you maintain the timing. It's not just to just take it twice a day. Try as much as possible to maintain the what? The timing too. That is not what they are teaching here, but it's better, it's good I mentioned these things. Now, ask.
For that anti-infective, you say we should, like, if is it every anti-infective you should give the dose 6 hours?
No. Look at this now. This is cured, yes. You don't need to be told that this should be 6 hourly. Something like amoxicillin. Something like amoxicillin now. Let's assume amoxicillin. Amoxicillin 500 milligram TDS. If you see TDS now, let's say TDS 1/52. This amoxicillin is TDS. And amoxicillin is an anti-infective. Is the penicillin. You don't have to be told that it should be what? Every what? 8 hours. Am I completing? This is what? Every what? 8 hours. 8 hours. And this is what? QDS. What? 6 hourly. Because in every day we have 24 hours in a day. If you divide it by 3, we have 8 hours. So that means you should take in what? Every 8 hours. You take one capsule, 500 milligram of what? Amoxicillin. That's the best way to do what? To take it. Am I communicating? So it's not that every infective must be 6 hourly. It depends on the drug in question. This thing has been done, and that's why there's nothing that is happening in this school. I will not come on time and tell you. If sometimes I seize the opportunity to come and give you information that will help you to grow, but most of it will throw it away. I think I have entered your class and told you to go and buy MDEX. Have you mentioned it in your class, in your first year? Didn't I say it? You carry it and threw it away. Maybe you thought that you will enrich me. No. You can go and do what? Install it in your phone. It will help you. By now, you have mastered all those things if you took what I told you seriously. These questions won't have been complicated. I know you will still come up to this. It's not late. If you don't have money for the hard copy, go and install it in your phone. Any drug you hear, you see, go there and look at the drugs. Learn these things. These are what will distinguish you from others. But I don't know. Better information if you throw it away. I'm listening to jargons that doesn't concern you. Now let's go. Be the bedtime. Please go and download. Go and look for Latin abbreviation for use in prescription. As simple as that. Look for Latin abbreviations used in prescription. There are many of them. It's scattered everywhere. Learn these things. BD means twice daily. Twice. Check their Latin meaning and what they. I'll give you information. Go and work on the information I gave you. And you limit all these questions that are wasting our time on the board. Okay? There's no way I can stand here and be teaching you all Latin abbreviation. No, it's not possible. Okay? What I should say, no. What is your issue? It's 52. It's 52. We are not. That's a mistake. It's 52. Okay, so then we have, of course, I have also mentioned weekly what dosing here, right? Weekly what dosage. There are some drugs you can take what weekly, depending. Drug like mefloquine. Drug like what? Mefloquine. You can take mefloquine. It's an anti-malaria. Have you done anti-malaria in your AUM? Have you? Okay. You still do all those things. Okay, now let's continue. You have weekly. You have one like mefloquine tablet. Mefloquine. We have 250 milligram milligram weekly. Okay, 250 milligrams. You see something like this. Depending on the number of weeks they want you to, the prescriber want you to, how long you want you to take it. Am I communicating? But just know that it's once daily. It can be this, depending, okay? Depending. But just know it's once daily. These things has been studied. This drug have been studied, and during the clinical trials and the process of drug discovery, these are what they checked to know exactly how long it can be taken to be able to achieve the therapeutic purposes. This is not what you decide at the clinic when a patient comes to you. It's not you don't close your eyes and just give anyhow. This has been done. There are some level that that during these drugs, every drug, there's no drug without side effects. Every drug has its own side effect, and the more you increase the dose unnecessarily, as you are trying to achieve a therapeutic purpose, the drug is also doing having other effects that may not be wonderful in the system, and that means you are increasing. As you are increasing the dose, you're also increasing the side effect or even adverse effects of the drug. Is it clear? So that's why you should be careful. Always, like now, something like diclofenac. Diclofenac on the more is taking 50 milligram BD, 50 milligram BD, morning and evening, as the case may be. Now, and the maximum dose you should take it is 150 milligram is the maximum dose. Maximum daily dose is 150 milligram. Maximum dose is 150 milligram. Maximum dose is 150 milligram. That's the maximum dose you take your the diclofenac. But some people will come and they will prescribing it. Anyway, they don't know. You see somebody telling because the pain refuses to go, the person will now recommend that, or even the patient may even take the drug on his own. Let's say 100 milligram twice daily, morning and night, 100 milligram. So that's wrong. That's wrong. If you take a drug at the recommended dose or the recommended dose and the thing is not giving you what you are looking for, the best thing is to leave that drug and go for another one that will be more effective. Instead of increasing the dose of that one unnecessarily, you better don't any drug you see, try as much as possible to look out for the maximum dose of the drug, daily dose. That will guide you on when to switch over to another drug. These things are important. Something like diclofenac at a very, very high dose, more than what you should take, can lead to kidney issues, kidney problems. Yes, if you watch now, there is increase in kidney problems amongst our population. We abuse a lot of things, especially pain relievers. We abuse as we drink it. We drink them like water. We drink them like water, morning, afternoon, night, all the time. Any slight pain, you go and take pain relief. Sometimes you come back, you are tired. You may just need to just sleep. Sometimes you may have a headache. You may just need to take water. Take water and put your head somewhere and you sleep out and you wake up refreshed. It's a sign that the same way your system will start misbehaving. You reboot it, you allow it. If you come back, it will start operating normally. The same way. Our sleeping is like rebooting our system. It's when you do all these things and the thing persists, then you can take paracetamol. If you take it once, take it in another occasion, and the headache is still there, headache is just a sign. It's not a disease. That you go and start pumping yourself with what? Paracetamol and other pain relief because you want to. If it after that, on one occasion, another occasion is still there, go and look for what is happening to you. Stop. It's a sign of underlying what? Issues you need to do what? Set. That is the sign your body is giving you that something is going on somewhere. Yeah, then you see somebody, you have pain. Pain is also a sign of something. Am I communicating? Unless it's obvious that you injured yourself in a particular, you're sure that this, even at that, you don't take more than the what? The recommended what? Dose. Am I communicating? So these are what you check out for in handling drug. The topic we are talking about what? Dosage calculation. That's why I'm talking like this. $150 is maximum dose. Maximum dose, 150 ml. Maximum daily dose. I say that the maximum dose is 150 milligrams. That's why if you see some, if you see some, there are some that will. That's why in the market, what you see diclofenac 50 milligram or 100 milligram. And 100 milligram, they usually sustained release. They usually what? Sustained release. Modified release, that you just take it once daily and it will be releasing the active ingredient that will cover you for the whole of the day. You don't take it morning and take it again night. No. You're not helping your system. Am I communicating? So these are things then even this paracetamol you could see. Paracetamol you drink like pure water. Paracetamol itself can scatter your liver. So you see that you just be careful. These things, take the recommended dose. And like now, there's one guy, I went to his patent medicine shop. Then I used to have time to market drugs. I was just at my even when I started working here newly, at my leisure time after work, I would just go around, visit some places. I had business links with different companies that supply me. I'll go around. But when my responsibility here started increasing, I had to limit my movements. So the point that I was trying to make is that one day I went to supply him one anti-malaria. See, I saw him. I don't know what led. One thing led to that. We said that I engaged him in discussion, and he mentioned something that why he used to pack different analgesics in one dose and give to a patient. I was like, why are you doing that? I can't remember exactly what led to that. But the point he made was like, is one of his, that they, after going to one of his neighbors, they'll come back and tell him that this social person will pack, once he gives you just a single dose of these painkillers. Because that's what they call it. Single dose of this, just a single dose of these painkillers, it will hit the pain once and for all. I said, he now said that one day he went, I don't know how he was able to get his own dose and open it. He saw he saw piroxicam, he saw diclofenac, he saw paracetamol, he saw all of them combined, ibuprofen, in one sachet, in one drug envelope. That's what he used to give to them. So he now started doing the same thing. And since then, they were coming to his own. Since then, they saw that they were like, I said, He said yes. I said, okay. He said, I tried to convince him. He said, no, but it's working. It works. And I said, wow. I said, okay. I then gave him an analogy. And I now told him, okay, are you aware that you can kill a mosquito with hammer? with an hammer? He said yes. I said, are you aware that you can kill a mosquito with just tapping the mosquito? He said yes. I said, okay. Let's assume you have a glass table and mosquito, maybe after sucking you, he perched on the glass table. Are you aware that you can use your hammer by your side and out of anger you hit the mosquito and the mosquito will die? He said yes. I said, are you also aware that you can just target the mosquito and gently tap it on your finger against the mosquito on the glass and the mosquito will die? He said yes. I said, are two of them not effective? He said the two of them are effective. I said, but do you know that the hammer destroyed both the mosquito and the glass? He said yes. But your finger just kill the mosquito and save your glass. He said yes. And I said, so which one would you now choose? Good morning. He said, I would rather tap mosquito. I said, this is exactly what you and other people that are flouting chemists up and down in this country are doing to our citizens, shattering their kidneys and saying that you are dispensing. That's why if you are not trained, the least that should be allowed is pharmacy technician. The least. If you're not trained to other drug, you have no business giving drug to a patient to go and take. If you're not trained in this line, you can have a wholesale where company will dump cartons to you for you. You sell in cartons. Wonderful. It's okay. But if you have no this basic training, at least pharmacy technician, you have no business giving drug over to a patient to go and take. I started telling him about the kidney problem is on the rise. Yeah, we know that there are some that have fundamental issues. That one is different. But the rise is too much. And I started telling him the effect of these analgesics to our kidneys. Apart from even including those that drink all this, they call it a lot of jargon they drink and call it what mixture. That one is there. But these analgesics, they destroy kidneys. NSAIDs have a lot of issues with the kidney. And I ask now, look at, in a drug envelope, someone has paracetamol, has ibuprofen, has diclofenac, has paracetamol. And this is how they drink it. Any small thing, they'll go and take it and drink, and they'll be okay. Over the years. After that, he now said that he will stop it. So, he's ignorant. He wants to make money. It's effective. What of the effect in the system? Tomorrow you say that you have not killed anybody with money. But you would have killed thousands without you are even knowing. And by virtue that it is written that you have no business giving drugs to a patient, be careful. Be careful. Because at the end, if you appear before God, you answer it. You'll be like, when did I do all these things? You've been doing it without your knowing. So now, that's why any drug you handle, please look at it critically and be sure that you know things about the drug. The maximum daily dose is very, very important. It's not just effective dose alone. Because all the drugs has been, before the drugs we are pushed into the market, clinical trials have been carried out to determine the effect of these drugs. Every drug has what is called, during that clinical trial, there's what is called therapeutic dose and what is called leather dose, above which, I think I mentioned this in your first year, above which these drugs should not be what? Exceed. And this constitutes, will tell you, that's what paracetamol has. This paracetamol is going to take it up to 10 tablets, you see what happened to you. Take up to 10 grams, you see what happened to you. Once. Paracetamol you joke with. Go and take up to 10 grams at a time. Then you see what will happen. So be careful about what you take and what you tell people to take. So be an advocate of safe and effective use of what? Medicine at the grassroots. I think that's what is in your anthem, right? Yes. Most of you will see yourself tomorrow. In fact, the main reason for this program is because pharmacists cannot be everywhere. With time, Nigeria is as it is. With time, the more we have more pharmacy technician. If you want to enter into practice, those that don't want to continue into university, if you want to enter into practice, I will encourage you, as you're living here, even if it's small amount of money, go and establish a pattern medicine ward. That is meant for you, not private what? Individuals. Not those that didn't see the four walls of school. That is actually your place. Yes. And the more we have more pharmacy technicians, you see that all these things will end. There is like this because there's no more much hands to take care of this. So the government is even handicapped. Am I complete? You see people, someone doesn't do anything. All you know is that you went to one chemist and learned that if you took this injection, this side, if you give this drug, any other thing concerning that drug, the person doesn't know. All you know that they told him or her, and this is what he should do. But when you take it down to the pharmacokinetics of the drug, all their attention is what? Efficacy. But as a pharmacist or pharmacy technician or a trained personnel, you know that this drug has other what? Issues you should monitor. What is it? Are you allowed to do what? Okay. No, you know, before a drug, I think we did this in your first year. Before a drug can be, we did this, I explained this in your first year. Before a drug can be presented as powder for oral suspension, what it means is that the drug is not stable in liquid form. Am I communicating? When the drug comes in contact with water for like more than that number of days, it will deteriorate. It will not be stable. Am I communicating? It may start forming other. The most important is that the drug itself will not be there complete again. But what it forms depends on the nature, the chemical component of the drug. If it forms something that may be dangerous to the system, it becomes dangerous. But it will form something else. That one is sure. But the question now is what will it form? It now depends on chemical composition of the drug. So that's why you avoid it. But the basic that will happen is that the efficacy will do what? Because the active ingredient has started forming something else. So that thing inside that should take care of what is no longer there. Because the drug on its own is not stable in liquid form, and you add water. So water is a medium for a lot of reactions. That's why ab initio you cannot formulate it as a liquid dosage form. Even though you administer it as liquid dosage form, it will come in powder. You use it, you disperse it or dissolve it as the case may be, and give and take. Am I communicating? Of course, there's no way you take it to stay in your system for 7 days. As we are taking it now, a few minutes, it will enter the system and go and do its work. But if you now put it and leave it for 7 days, it will do what? The active ingredient will go down, because the reaction must definitely take place. So whether it will be harmful or not depends on what it forms. And even if it's not harmful, by virtue of the fact that what you intend it to do is not doing it, is a problem on its own. Because you may be taking it for a long time. Maybe the person may have a serious issue. Maybe antibacterial, what is it called? disease from bacteria and what have you, and the person will think that he's taking what? Antibacterial, without even knowing that he's not taking what? Anything. It can also lead to what? Resistance, because the drug is not doing what it should do. Am I communicating? Now, someone asks, I wouldn't want to go into that. Please, when you go to your PTP, you ask that question. But the point there is that I want you to understand something. That most of you people go to find this is what you are doing in your PTP first year now. Anyway, it's okay. But the point there is that when you don't have every drug, just as we have pattern medicine shop, we have pharmacy. It's not every drug you can do what? Dispense. You can do what? So is when you get there, but before you do what? You get there. There's a list of drugs. If a pharmacy which is reviewed, depending on the need. Am I communicating? So I wouldn't want to draw a particular line now on that. After all, people that are, community health officers carry injection is up and down. But the point is that I wouldn't want to draw a line. There's a list of drugs you can stock as a patent and proprietary medicine vendor. There's a list of drugs you can. Am I communicating? But here, people do anything anyhow and go scot-free. Nobody respect that. But when you know, when you be reminded that you should know is when you enter into trouble one day, then the court will remind you that you are not supposed to do what? Handle this. That's when you say, I didn't know, they didn't tell me this. And ignorance of the law is not an what? Excuse. When you be doing it and be going scot-free because nobody monitors you. Nobody regulates you, even though you are being regulated. You get the statement? Nobody regulates you, even though you are being what? Regulated. But it's when you actually enter into trouble one day. Maybe one day someone will come to your Kedafia. You are medicine shop, and you give a jar, and the person collapse. That's way you understand that you're not supposed to do what? Do it. The person that's coming to you, you don't have the person's history. There's no medical history of the person. You don't know what the person has been given since. You don't know what the person has been passing through. You don't have the person's record. The person's actual record may be with one hospital, and he comes to you. Maybe he ran away from the hospital. You don't want to continue. Maybe for one reason or the other, you come to you give a jar because you know that you know how to chew. You can do this, or maybe they come to buy from you because you think you have what it takes. You have more capital. You can stock anything you like. Then you sell, and this thing goes. Is when there will be trouble one day, then they trace where they got the drug. That's when your eye will open. You know, I didn't know that I should not stock this thing, but better you are already in the cell, saying, "Hey, I didn't know," and I'm not like I didn't know. So that's why you ask questions and do the right thing. Ask questions and do what? Right. Money is not everything. You see, money is not everything. Do the right thing. You can be stocking, even as a pharmacy technician, you can open your small pattern medicine shop, as small as it is, and see the list of what PCN say you should sell, and diligently stock it, and diligently take care of your patient at your own level, and you're doing it with all sincerity. And when a patient comes to you to look for the ones you don't stock, and you didn't direct the patient on how to get it, where the right place, maybe a pharmacy by your side, to go there and get it. That your sincerity can make you a millionaire. That's what people fail to understand. That your integrity can make you a millionaire. When it comes to the ones you know you stock, the person may even say, people, go to this person, he will tell you what? The truth. Am I communicating? being a millionaire, forget this. If you like, read from now till be a professor of economics in Harvard. If you like, have capital of 20 million. Ego snatchy. You see money, you see being rich. As in, rich is from God. It's not by what you do. I'm not communicating. It's not even by the court you think you want to enter. I'm not communicating. It's not even by whatever you think, okite you think you're carrying. Forget that thing. You see money. It's only God knows how he does it. You may see someone that don't even know anything. You may see someone that people call Onuku. Hello? You will see people that they tell Onuku, no common sense. But the person is rich. When it comes to things that have to do with brain work, you invite those that help you to use wisdom to maneuver the thing. But as for money, so how did money come? How can you explain that? You say it's opportunity. It is how you. It's not true. You may say it is how you pray. You may pray for money tonight. She will not see. You may say it by coming in the morning and going by in the night. You may do it. You. Hello. So the point I want to make is this: do the right thing, okay, and leave the rest. If you are destined, if you are among those God has destined that they will have, you will give that money so that they can redistribute among others. Then you will pick it up and give it the thing. Simple. Amen. So do the right thing and forget all those things. Don't cut corners to make money. Don't cut any corners. Do the right thing. Yes, sir. Of course, I used to tell people, I don't know the other face to you. I can't remember. Please, if your mission for entering pharmacy school, if your mission is to be rich, better withdraw now. If your mission, hello, go and mark my words now, please, because you're frustrated when that rich doesn't come. If your mission is to be rich, better do what? Withdraw. Listen to me. This is a hard truth that people may not want to accept. If your intention for entering health-related course is to be rich, better withdraw and go and do other what things. Your primary purpose here is to what? To save life. Hello, that should be your primary purpose. Yes. Please examine yourself again. If it is not, just withdraw and go and do other things. You can become rich. Hello? You can become rich through that. True of us? True. Makeup. Go and learn makeup. You can become rich through that. True of us? Very well. Hello? Hello? There are many things that you know that you are doing this to become rich. And there is nothing wrong there. Hello? Good. So the point there is this. Your purpose here should be to save life. That's why it's better the type of... There are some courses before you even go to study. Like if you simply go to different maybe country that things are running the way they should. Okay, Mr. Boniface is waiting for me. I forgot that we have to start today, right? Yes. By what time? 9. And I forgot. Mr. Boniface, I forgot to say that we have the my head. Don't mind me. Let me round off. All right, so the point I'm making is this. It's because of this nonsense, this mindset. A lot of people are entering into medical field because that is where they believe the money is. And that's why you see people cutting what? Corners. Just to do what? Make ends what? That's why you see a human being will go a drug that is expired. They will go and start changing the word. Because their intention is to do what? Make money. And that's why you see someone that will have the mind to go and package powder. To go and package powder and be selling to his or her fellow human being. Just because he wants to do what? Make money. And that's why you see somebody, we buy a drug at 15 naira and we get mine. Put it in front of him, say that he's giving an injection that he just is not even up to 1/1,000,000th of what he wants to be, and he go and inject to his fellow human being and say that because he wants to make money. Am I converting? Yes. So there are some courses, and in outside the country, civilized world, there's some courses before you do. They are not doing it because they are hungry. That is because they want to do what? Contribute their quota in saving life. Am I communicating? Of course, now you will not be hungry. That's one thing. The money will come. Okay. But the point is this: when you have the back of your mind, that's when you will not have integrity in what you are doing, and that's why you say you are practicing. And let me stop here. So that Mr. Body will continue tomorrow. So in our next class, we just go straight to. In our next class, we just go straight to what? Calculation. Okay? Calculation. I will talk about dosage regimen, what it means. Then after that, we just go to what? Calculations. That's what we do in our next class. Then after that, we go into what? Pediatric what? Dosing. All right. Thank you very much. Any question? Any question? All right, thank you very much for your attention. God bless you.
Well done, my dear.